This time, Dr. David Lalloo fights an elusive enemy.
The bottom line is not clear exactly what it is.
You wouldn't believe a little creature like that can put a grown man down.
And heads to Africa to battle a devastating disease.
How long, sir, have you had a problem with swelling of a leg?
Dr. Bertie Squire takes on persistent parasites.
I think I said to you last time I have one more drag up my sleeve.
And terrified patients.
We're just so frightened, really. We're horrified.
This crack team wages war on deadly bites and alien body invasions, battling lethal infections from around the globe. Only they stand between you and bugs, bites, and parasites. The Liverpool School of Tropical Medicine is the oldest centre of its kind in the world. Along with the specialist unit at the Royal, its staff are dedicated to curing the 1,500 people referred here each year with mysterious infections and infestations. World expert Dr. David Lalloo knows only too well how cunning parasites can be.
There are thousands of different parasites, some of which are very rare, and which can create a real puzzle in people who may come back from the tropics with an odd illness.
In the emergency department at the Royal, David Lalloo and his team face a challenging new case. 66-year-old retired builder Graham Nash has cut short a once-in-a-lifetime trip around Southeast Asia. Terrified by a wound on his leg, he's travelled 1,400 kilometres to come to the Royal.
I was like this for 14 hours on the plane. I should never went anywhere myself. I'm stupid for going.
Graham was in Cambodia when 3 days ago, in a bar, he had a painful encounter.
I looked on the floor, seen the scorpion running away. And the young Cambodian girl picked it up by the tail. And she said, nothing to worry about that, George. That won't kill you.
24 hours later, Graham was writhing in agony in his hotel room.
On the Saturday night, it just started going. And I thought, oh. So all I done was went downstairs from the hotel. I walked around the corner. There's a travel agent there. And I said, have you got a night bus back to Bangkok?
In Liverpool, night shift registrar Lindsay Goodwin received the terrified traveller at the end of his marathon journey.
That involved a bus ride to Bangkok, flight back into Manchester with a stopover in Dubai, where he called his GP who advised him to come to here. So then when he arrived at Manchester, he took a train to Liverpool and he arrived at the Royal. So quite a journey to get to us for some advice today. We need to keep a close eye on you.
Okay.
I think that's going to mean admission to the ward.
Okay,
and observations overnight.
Okay.
And just because of how indurated this looks and now it's weeping, it may be that we need to start some antibiotics.
Okay, no problem, doctor.
And I'll speak to Professor Lalloo, who is one of the tropical consultants, who's an expert in bites and envenomations and things like that. We get to see lots of different types of infections usually, such as diarrhoeas, chest infections, urinary tract infections, but there is that excitement that starts when the phone call comes and it says there's a scorpion sting.
There are over 1,500 species of scorpion. Over 20 of them are dangerous. Their sting produces severe pain and, in some cases, worse.
In children and in the elderly, the venom can sometimes activate chemicals from the nerves, and that can lead to high blood pressure and heart failure, and unfortunately can be fatal.
Graham faces an anxious night.
You wouldn't believe a little creature like that can put a grown man down.
Don't you want to try Butlins next year, love?
For David Lalloo and his colleagues, deadly infection is an occupational hazard, particularly when they work abroad.
I bet Bertie's had malaria. You've had malaria as well.
You're not allowed to bring that up again and again. Yes,
what?
I have.
Have you? Well, I was telling these guys before, you're only a proper tropical medical physician once you've had malaria.
Or some people say you're only a proper tropical physician if you've not had malaria because you've avoided it.
Yeah, exactly.
No, I had malaria.
Consultant Bertie Squire's fascination with bugs, bites and parasites began early.
My passion for tropical medicine and infectious diseases started because of my own childhood in Africa, and a sense of wanting to do something about well, that sounds very high-flown, but just being in the environment of the tropics was why I started being interested.
Today, Bertie Squire's on duty across the road from the School of Tropical Medicine at the Well-Travelled Clinic. The clinic can be the first port of call for travellers off on an adventure, or the last resort for worried patients with nowhere left to turn.
Okay, we'll get started in a second. Bear with me one more minute.
Bertie Squire's patient is 27-year-old Catherine Wright, an HR assistant from Rhyl in Wales. She's been suffering from chronic diarrhoea since a trip to South Asia 7 months ago.
I went to India in February for a family holiday with my mum, my dad, and my auntie and my uncle. We went to a rooftop hotel, had the chicken, it was chicken and mushrooms, which is my favourite meal. And I just started eating the chicken and I thought, this doesn't taste right. And I think I ate half of it and I thought, I'm not eating any more.
Catherine started to feel ill on the flight home to the UK. By the next day, she was in constant fear of a humiliating accident.
When you get a bug, you get that really griping pain and you know then you've got to go. You've got to go to the toilet and it's water. It's as if you're weeing out of your bum. And you think, I'm not gonna... You're scared to pass wind because you think, is that going to the toilet or is that just passing wind? So every time you get that urge, you've got to go to the toilet.
After weeks of agony, the third GP Catherine saw in Rhyl called in the team from Liverpool, who promptly asked for a stool sample.
Not many people, I assume, look at their poo, but when you're having to put it into a pot, you have to look at your poo. And I'm popping it into this pot and I'm thinking, that doesn't look normal.
Catherine's sample is one of the 4,000 examined each year at the School of Tropical Medicine's specialist diagnostic lab. Every day brings deliveries ranging from urine, maggots and worms to sputum and stools, sent from all over the UK and beyond.
When you open a container of a pathological specimen, the user does not want to have any splash on them at all, or aerosols that they could breathe in. So it's a lot safer to use it under the hood. We love the hood.
The results of Catherine's first stool sample were phoned through, out of hours, by her GP.
When she phoned me to say, you've got Gordia lamblia, so I asked how to spell it, and she said, oh, you know, I'm just so relieved it's not a parasite, thinking it would have parasite. She just called it a parasite. She said, I think you better Google it. And I did. I wasn't impressed.
The life cycle of Catherine's parasite started with a cyst expelled in the faeces of an infected person. The cyst has a hard shell and can survive for months outside the body. After Catherine ingested the cyst, the parasite evolved to its feeding stage, gobbling up food from her gut and reproducing. Catherine's agonizing cramps were caused by her body's immune system attacking her parasite. Giardia is spread by poor hygiene practice, particularly when preparing food.
It's from what's classically called the fecal-oral route, so any fecal matter that contaminates food or water can therefore lead to a new infection.
It's basically gone from faeces into my food, so all I had in my head then was I've eaten poo. Which, again, sort of, it was, no.
Coming up, bite expert David Lalloo is stumped by Graham's gammy leg.
I think the bottom line is not clear exactly what it is.
Consultant Bertie Squire wrestles with Catherine's persistent parasite.
I think I said to you last time I have one more drug up my sleeve.
At the Well-Travelled Clinic in Liverpool, consultant Professor Bertie Squire is grappling with the parasite Giardia lamblia, which has been lurking in the gut of his patient Catherine Wright for over 7 months, causing her acute pain and chronic diarrhoea.
So lovely to see you once more. We saw you in May, who showed that you had Giardia cysts in your stool at that point.
Since May, Catherine's been sending poo samples to the lab in Liverpool for testing. Bertie hoped her Giardia had been wiped out, but her latest sample shows the parasite is still attacking her gut.
I was hoping that we wouldn't have to do this. So we've been so hopeful in September when the results came back negative.
Bertie Squire suspects that Catherine's parasite may have become stubbornly resistant to 2 types of antibiotics which he's prescribed so far.
Any bacteria or parasite that is exposed to a drug, there will be, by natural selection, some of those bugs which will be relatively resistant. There isn't much alternative but to try a sequence or combination of the drugs to try and get clearance.
Bertie Squire is bringing in the pharmaceutical big guns.
I think I said to you last time I have one more drug up my sleeve.
To beat the persistent parasite, he prescribes Catherine a 3rd, even more powerful antibiotic. She'll need to produce a further 8 stool samples over the next 7 weeks to know if it's worked.
I'm just writing a prescription out for a lady who I'm about to send across to you from the tropical school.
Bertie Squire has more bad news for Catherine. He suspects that the Giardia parasite isn't the only reason for her gut-wrenching gripes.
Okay, perfect. Cheers, bye. It may or may not be the big driver of what's going on in the way of your symptoms. I was just been a little bit worried that it isn't only Giardia.
You do feel as if it's turned your life upside down. You do ask yourself, is this going to get better? Or am I stuck with this?
Hi, Lindsay.
Morning. How are you?
I'm fine, I think. I gather you got an unusual patient.
Up the street at the Royal, bite specialist David Lalloo's expertise is needed to treat retired builder Graham Nash. David is updated by specialist registrar Dr. Lindsay Goodwin.
And is he all right?
He had a low-grade temperature last night, and he was hypertensive, and he was tachycardic, and he has quite an impressive area on his right leg where the scorpion stung him.
Did he do anything to it afterwards? He didn't put anything on?
Yes,
right.
he did. So after he had the bite, he washed it with cold water, and then he's been bathing it in iodine on a daily basis.
Okay, but nothing silly like cutting it or putting a local herb on that might have caused inflammation?
No, not that he mentioned to us, but I didn't specifically ask.
Should we go and see him?
Yeah, sure.
Graham was admitted hot off the plane from Cambodia with a suspected scorpion sting on his leg. After a dose of antibiotics, he spent a restless night in the Tropical and Infectious Disease Unit.
I'm still in a lot of pain. I was sick through the night, vomiting. I've been awake since about 4:15, and I just opened the blinds and looked out the window. Come in, sir.
Mr.
Good
Nash.
morning, sir.
Hi.
Good morning.
Hi, I'm David Lalloo, one of the
Pleased to meet
consultants
you,
here.
sir.
So I've heard a little bit about it. Could just tell me...
What happened was, last Friday night, I'm in Cambodia, and we were sitting downstairs in the bar, and I felt something scratching.
Right,
And I thought, Christ, what's that? Next thing, I see a black scorpion walking across the thing. But the young lady...
So how big was this?
About 4 inches.
Okay, fine.
And she said...
and absolutely black?
Black, pure black. She said,
right.
You're lucky if that had been the other one with any white on it, you would have been dead. All that is they eat them.
Right, sure.
She picked up and put a pin through it and cooked it. But she said, what it is...
You didn't join her?
No, thank you.
Oh, yeah, absolutely. Apparently a scorpion was caught, but he then tells me it was eaten, and it would be much more useful for us to actually have it here so we could identify it.
With the insect evidence consumed, David Lalloo only has the wound to go on to identify the exact culprit.
Can we have a quick look at this?
Yeah, by all means, sir.
On close examination of the wound, David Lalloo's not convinced the scorpion is to blame.
If you'd showed that to me blind, I would have said that's more in keeping with a spider bite than a scorpion sting. Because most scorpions don't cause... You may see nothing, or you may see a bit of erythema. There are odd exceptions, and of course it might be an exception, but the degree of skin necrosis there is quite marked.
Necrosis is the death of body tissue. It can be caused by anything from a wound to frostbite and animal venom. Antibiotics have prevented Graham's condition from becoming life-threatening.
The plan is we'll keep the antibiotics going. We'll just watch the inflammatory markers, I think.
The team is doing battle with an unfamiliar enemy.
It's a really unusual case. You know, in fact, I was trying to think last night when I was first rung. I'm not sure I've ever seen a scorpion sting on this ward in the 10 or so years I've been here. So it's, yeah, I think it's an interesting, it's a very unusual case. They may never see one again.
At the well-travelled clinic, Bertie Squire's next patient fears she has a condition so stigmatised that she doesn't want to be identified. For 15 years, she's suffered from swollen legs, or edema.
Half brothers, is that right?
The patient is from Africa, where she's afraid she's contracted one of the most disfiguring of all tropical diseases, lymphatic filariasis, or LF.
Is it just the swelling of the legs?
Yes, they swell. And also when I get a wound,
yes,
it takes long to heal.
Has anybody discussed filariasis with you as a cause of edema?
I did a test. It was not conclusive.
Lymphatic filariasis is transmitted by carrier mosquitoes dropping larvae on the skin as they feed. If Bertie Squire's patient is infected, the larvae will have burrowed into her lymphatic system, the network of vessels which carry fluid around her body. There, the larvae will have nested and grown into adult worms, causing inflammation and potentially massive damage to her lymphatic system. In its most extreme form, LF can lead to gross swelling of the victim's genitals and legs, known as elephantiasis.
When you read about the condition online, wow, it's scary. It's scary what it can get to if not treated.
Such a deformity is both difficult for the patient because they then can't walk effectively, and it's obvious to anybody who sees the patient that they've got this huge swollen leg, and that gives a lot of stigma.
Bertie Squire's patient's been tested for lymphatic filariasis before, but not in Liverpool.
I think we should do some blood tests just to have a documentation here in an accredited laboratory about whether there is any sign of inflammation. The second thing that I think is worth doing is worth looking for the microfilaria of filariasis once more. I think it's difficult to say rule it out because making the diagnosis, yes, it depends on finding those things, but sometimes we miss them.
David Lalloo is leaving shortly on one of his frequent research trips to Africa, to an area heavily infected with lymphatic filariasis. As part of his preparation, he's being briefed by Professor Mark Taylor, one of the most senior scientists at the School of Tropical Medicine. He's at the cutting edge of the fight to beat this terribly disfiguring condition. Professor Taylor is an expert on the parasite which causes LF.
It's one of the most feared tropical diseases because of the gross clinical pathology you see. And individuals suffering from elephantiasis are often shunned from society. They're sort of not taken care of, they find it difficult to make a living. So it has socio-economic consequences.
Professor Taylor, working with the clinical team headed by David Lalloo, is on a hunt to find a cure for the plague of LF.
Hi, David. We can get you to put one of these on. Thank you.
Mark Taylor's team is harvesting parasitic worms in order to test the effects of different drugs.
So here we've got the team dissecting the mosquitoes. Mosquitoes get crushed.
Okay.
The infected larvae come through a mesh, and then what we're doing here is picking them out, and they're hoping to collect about 3,000 today.
The larvae are cultured into adult worms.
So we're a worm production factory at the moment. We generate 6,000 worms a fortnight.
Wow, is that right?
Yeah. So this is one of the specimens of the adult female worm. Don't, whatever you do, drop it, David. It's a precious sample.
I bet it is, actually.
David Lalloo's a busy man. On top of overseas research trips, he has needy patients in Liverpool. He's checking on the progress of Graham Nash, who believes he was stung by a scorpion in Cambodia. The returning traveller is worried that his leg will have to be amputated.
I thought I was going to lose my leg. I did. I actually thought my foot was going to come off and my leg was going to come off.
Overnight, David Lalloo consulted fellow experts about scorpions native to Cambodia.
There's still a huge amount we don't know about venomous animals and insects, and it's not unusual to come across something new that we are learning about, and it may well be, in this case, that it's a scorpion that we were not aware could cause tissue damage in that part of the world.
Despite appearances, David Lalloo has good news for Graham.
It's definitely not progressing or getting worse.
Yeah, oh, well, that's all right. That's okay.
And I look at it's just looking a bit healthier and settling down.
Oh, that's
actually.
good. That's great. Like you see, it didn't seem to be as tender there. It's only around the outside where it's tender. In the middle, it didn't seem to be tender.
It's definitely not getting worse. That's great. I'll just pop that back on. He is lucky in some respect that he was stung by a scorpion that did not have any systemic effects, so it didn't affect the circulation. It didn't have any of the severe problems with his breathing or with his heart that we sometimes see in some scorpion stings.
David Lalloo thinks it's now safe for Graham to go home.
It's a nice little party story, isn't it? To be sitting in anywhere's house having a wine or something, or to be in the pub, you know. And somebody says, oh yeah, I fell up the scaffold and I broke me. Then I say, well, I had a scorpion bite. What? And they won't believe it.
Coming up, Bertie Squire is in the Last Chance Saloon with his diarrhoea patient. He hopes his latest treatment has zapped Catherine's parasite once and for all.
We've had a few negative samples since September, and hopefully this one will still be negative.
David Lalloo and his colleagues in Africa encounter one of the most terrifying diseases on Earth.
When I open this, when I'm working openly without this cover. When the children see me, they're crying.
At the Royal, consultant Bertie Squire has a new patient. 62-year-old Anne Hayhoe and her husband Bob recently returned from their favourite holiday spot off the west coast of Africa. On the advice of her GP, Anne's just been rushed by ambulance 70 kilometres from her home in Macclesfield.
Coming to the Royal to have various tests to find out about the
Viral infection.
Viral infection that I seem to have got from the mosquitoes in Madeira.
For the last decade, Anne and Bob have holidayed 3 or 4 times a year on the idyllic island of Madeira.
It was business as usual on holiday. It was just having a lot of nice sunshine and food and meeting nice people. Just had a really nice time.
3 days after Bob and Anne returned from paradise, Anne fell ill.
I was very worried because she was shivering, shaking. I couldn't touch her. She was sleeping 20 hours a day.
Bob's daughter read a story in the paper saying there'd been an outbreak of a disease called dengue fever on Madeira.
That was worrying to me, reading the symptoms. And at that time, I think there was either 8 or 10 symptoms, and she had every one except for the rash and the itching.
Dengue fever is known as breakbone fever because it's so painful. It threatens 40% of the world's population. Anne was in Madeira during the worst outbreak there in 90 years. Infected mosquitoes bite the victim and inject a virus. Like so many viral infections, there's no specific drug to cure dengue fever.
It's an illness that I would do my best to avoid, because if you get it, you feel terrible. You just feel awful when you've got it.
If left untreated, patients can go on to develop severe dengue, low blood pressure and internal bleeding. Around 1% get full-blown dengue shock, which in most cases is fatal.
We're just so frightened, really. Horrified.
I thought I was going to lose it last week. It was that bad. Yeah, I've never seen her as ill.
He had his private thoughts of, I now know that he was thinking the worst as well before, which... Sorry.
Anne's blood samples have been checked, but dengue's a hard disease to diagnose because its symptoms are very similar to other illnesses, from malaria to a bad case of flu.
That makes it a hard conversation to have to the patients, because you can't say to them when they're feeling grim, I know absolutely this is dengue, or it's rare that you can say, I know for sure this is dengue.
In the School of Tropical Medicine's diagnostic lab, senior biomedical scientist Jayne Jones is examining a stool sample belonging to another of Bertie Squire's patients, Catherine Wright.
She's a patient who we found Giardia in May this year, 2012, and then follow-up samples to remain positive until September, so that's quite a while really, and we've had a few negative samples since September, and hopefully this one will still be negative, and she's been sorted out for her Giardia. So we'll just have a good look around the sample, which is quite soft, so she's not quite back to normal maybe, but we'll have a little look if there's any parasites there.
This is the moment of truth for Bertie Squire. He's been grappling with Catherine's parasite and her chronic diarrhea for over 7 months.
There is a sort of slightly sinking feeling when you open the notes and you see the most recent set of stool results and you think, yes, it's cleared, we've helped her, it looks like things are going the right way, only to find that on phoning her up, she said, yes, the symptoms are coming back again. Come in and
Thank you.
Have a seat. Weave your way around my chair. Doing very well.
I'm feeling better. I wasn't
you?
too good a few weeks ago, but I'm feeling a bit better now.
Pleased to meet you. Don't think we've met, have we?
No, I'm a father, Steve.
Good to see you. Good to see you.
Bertie Squire's about to disclose the results of the 8 stool samples Catherine's provided over the past 7 weeks.
So have a look through these. What you'll see is on 13th of November, we looked at 2, negative. 19th of November, negative. 28th of November, negative. 3rd of December, negative. And then there's one awaiting today.
There's one today.
So first signs are good. No Giardia cysts there. So thankfully for Catherine, it looks like she's still responded to treatment and she's not got Giardia anymore.
That run of sort of 6 weeks of no parasites in the stool makes me think that we've probably cleared the parasite, I'm touching wood, and that really her ongoing symptoms are something else.
As soon as he said today that they were negative as well, it's just relief, absolute relief. Now I can find out what else is going on.
The parasite defeated, Bertie Squire has his suspicions as to why Catherine's still suffering from chronic diarrhea.
She's got a family history of inflammatory bowel disease, and there are some features of how she was when she first came which make me worry that that still needs to be really taken off the list. Really, that call is now rests with the gastroenterologists. All right. Let's hope we've dealt with it.
Yeah, wonderful. Thank
Catherine's local hospital in Wales will now investigate whether she has a non-parasitic problem with her bowels. With her Giardia bug wiped out, Bertie Squire's work in Liverpool is done.
That's 10 months, 3 GPs, a specialist registrar and a consultant, all to get rid of one little bug.
In Liverpool, the battle to defeat terrifying tropical diseases which threaten 1 billion people worldwide is relentless. In 2005, Professor Mark Taylor made a major breakthrough towards beating the disfiguring disease, lymphatic filariasis, or LF.
We were interested in why this worm causes such severe disease. It has a big inflammatory reaction. And so we were looking what was the cause of this inflammation, and we actually found it was this bacteria which was driving a lot of the inflammatory disease.
Professor Taylor and his team had discovered a bacterium that lives inside the worm. He realized that the worm was dependent on the bacterium. It was a eureka moment.
Once we found that, the bacteria was essential for the worm to survive. Then it was obvious that we should start using antibiotics to try and eliminate the bacteria. And when we did this, it showed that the worm couldn't survive without the bacteria and died.
Professor Taylor's award-winning work is supported by a £15 million grant from the Bill and Melinda Gates Foundation.
You're always striving to make an improvement in the lives of the people that suffer from these diseases, but very often the advances you make are small and incremental and perhaps don't make a big impact. But every now and again, science can actually deliver real impact. It's a first step to the journey of eliminating this disease globally.
David Lalloo is heading for Tanzania in East Africa. This is where much of the information for Professor Taylor's groundbreaking discovery was gathered. As a clinician, David is interested in how research in the lab might, in future, help the victims of LF worldwide. Dar es Salaam is one of the fastest growing cities in Africa, with a population approaching 4 million. Here, David is working with fellow doctors, also determined to beat the parasitic plague. Dr. Wilfred Lazarus has specialized in tropical diseases for 13 years, particularly in the treatment of LF.
Clearly interested in lymphatic filariasis, and we're just really keen to hear about how, whether it's a big problem here and how much you see.
It's a big problem.
Yeah.
So far, generally, we have around 5 million people who are suffering from the complication from lymphatic filariasis.
So 5 million in the entire country. Gosh, yeah. So that's a huge proportion of the whole country then.
Here in Tanzania, 1 in 9 people are infected with the parasitic worm. David Lalloo is seeing patients at Dr. Lazarus's weekly clinic. 62-year-old Saidi Mukumba is a former builder and security guard and a father of 3. He has the most severe form of lymphatic filariasis, elephantiasis.
When I open this, when I'm working openly without this cover. When the children see me, they're crying.
So how long, sir, have you had a problem with swelling of the leg?
It was starting slowly.
Right.
When?
For 1983.
1983.
It started with the swelling of lymph node behind the knee joint.
With a fever.
With a fever. Yeah. Okay, so you remember that starting, and then it got worse and worse. It must be quite difficult walking with that foot.
It is heavy.
Yeah. Yes. Is it painful?
Sometimes.
It causes pain.
It is pain.
So how has this affected your life, having the foot like this?
It has affected me because what can I do now?
Sure.
Yeah. One of the effects he has is to lose job.
And you had to stop your job because of the problems the foot was giving you? Yeah.
What can you do about this?
Sure. Sure.
Ndio maana nilisema ya kwamba mimi ni mfanya kazi, si mvivu. Na kwa sababu si mvivu, ningekuwa mbali sana kimaisha. Lakini ugonjwa umenisababisha kimaisha nisimame. Na ndio maana nikasema kuwa nimekwisha kwa sababu utendaji wa aina yoyote sina.
What's your experience about this?
Well, I can't give you my experience of this to this severity, but with similar conditions, I don't think even in the UK we could do anything about this degree of damage. Because the problem is there's no healthy tissue to use for reconstruction. There'll be a lot of damage there. The crucial thing is preventing, as you say, secondary infection and trying to diminish any further inflammation to stop it getting worse, I think.
The doctors can only provide Saidi with advice on how to manage his condition. In Liverpool, Bertie Squire's patient, Anne Hayhoe, has recently returned from the popular holiday destination of Madeira where there's been the worst outbreak of dengue fever in decades.
It's been quite a shock, these last 10 days, really.
Bertie Squire is heading for the morning meeting with his colleagues. The results from Anne Hayhoe's blood samples are through.
She has normal inflammatory markers. She has low platelets, low white cells, and high elevated liver function tests. So it's pretty much in keeping with dengue.
So I could see her tonight and she could potentially go home.
And she will appreciate it.
Is she keen to go?
She is.
Bertie Squire must now share a mixed message with his patient.
The blood results certainly suggest that there's been a viral infection. Unfortunately, the blood results that we have at this point are fairly non-specific for a viral infection. So a viral infection will put up your lymphocytes, put down your platelets, make some abnormalities with the liver function. That would happen with many different viruses. So I think it all fits together as a dengue diagnosis. There isn't any specific treatment for us to give you. You've had the right things along the way in the sense of analgesia, anti-inflammatories to sort of keep on top of that. It probably is daunting for a patient to be told that we don't have a specific antibiotic or a specific antiviral agent for dengue. I think in the current world, people pretty much expect to be told, you've got a sore throat and I could give you this antibiotic and get better. Given that you're quite well, I think, I'm happy for you to go home this evening.
Thank you again.
All the best.
Thank you.
Okay.
Thank you very much.
Bye.
Bertie Squire may have discharged Anne, but the battle against tropical diseases is non-stop.
My energy levels are flagging. I'm thinking about my long-haul flight to Malaysia tomorrow and realising I'm not going to get a lot of sleep tonight. I'm not ready to fly yet. I haven't prepared my talk. 2 of my talks aren't ready. I haven't packed my bag.
Coming up, Bertie Squire unlocks the mystery of his patient's swollen legs.
Let's just concentrate on what you've got.
David Lalloo sees a patient with unusual symptoms.
She's getting milk urine, or sometimes milk-like urine with blood.
At the Royal, Bertie Squire's treating a patient who has suffered for 15 years from swelling to both legs. She's scared she may have the distressing disease, lymphatic filariasis.
So I'll probably pop over back to the school then.
Cheers.
You're just going to do a few phone calls now, are you?
I'm just going to do these phone calls.
He has the result of a blood test that had to be taken at midnight.
New line, midnight EDTA for microfilaria - negative.
Bertie Squire's hunch was that the swelling in his patient's legs, or lymphedema, was not caused by the LF parasite.
My own sort of whole diagnosis was that this was probably not filarial lymphedema. So one of the most important pieces of information that I really wanted well documented was whether she has or has not got microfilaria in her blood. I'm convinced now that I've got and can document a negative midnight blood, which I think for her future management is an important piece of information for her to be able to carry and talk about.
Bertie Squire's patient is so worried about the stigma of LF that she doesn't want to be identified. She's free of this condition, but not out of the woods yet. She clearly suffers from a buildup of fluid in her lymphatic system. This condition, lymphedema, can be caused by injury and is sometimes hereditary. It can't be cured, only managed.
So, unfortunately, I'm giving you a slightly difficult message. Your legs are always going to be swelling like this.
We can't solve that.
We're never going to reverse that.
Was it reversible?
It's almost never reversible. It's more difficult to talk to somebody about an illness which is going to be progressive, whatever you do, and that progression is likely to have a big impact on very important parts of normal life.
On the plus side, Bertie's patient has tested negative for lymphatic filariasis. With advice on how to manage the swelling in her legs, this comes as a huge relief.
I'm excited and I'm hopeful that I'm going to see a change in my limbs and in the condition.
Bertie Squire's colleague, David Lalloo, is in Dar es Salaam with Dr. Wilfred Lazarus and sonographer Dr. Francesca Tamarozzi at the weekly clinic. They're seeing a patient with a definite diagnosis of LF. 22-year-old mother, Fadila Habibu, has some puzzling symptoms.
She's getting a milk-like urine, or sometimes milk-like urine with blood.
And how long has this been going on for?
Okay, since 2007.
Fadila suffers from severe pain when she urinates. The doctors are on a hunt to discover whether this is connected to her LF. The risks to Fadila include recurrent urinary infection and loss of proteins, leading to anemia and malnutrition.
We have the wall. This is all the urine inside the bladder, and this is the posterior part of the bladder.
David Lalloo reaches an unusual diagnosis.
That lady had a rare complication of filariasis where there's a link between the lymphatics, which become damaged and enlarged because of the worm, and the urinary tract. And so essentially the lymph fluid passes not as it normally does into the bloodstream, but passes into the urinary tract.
There is no, at least there is no dilation of
Sure.
the ureters or calyces, so they look normal. So this is as much as I can see in their kidneys. She looks perfectly.
It was obviously disturbing her a great deal, and the trouble is it's very, very difficult to do much about this. Even in the best circumstances, it's a complication that's difficult to manage. I'm not sure how easy it will be to help her at all. The patients we've seen today really just reflect quite how awful a disease lymphatic filariasis can be. It emphasises yet again how important it is to control this disease, because the problem with filariasis is that by the time you get symptoms, a lot of the damage has been done, the lymphatics have been destroyed. And so really you need to drive down the chance of the disease occurring to the point where very few people are infected and even fewer have those severe complications that we've seen today.
Working with their partners in Africa, the team at the School of Tropical Medicine are running trials of the antibiotic which kills the parasitic worm which causes lymphatic filariasis. Their aim is to exterminate the parasite from the population, break the cycle of reinfection by the mosquito, and ultimately eradicate this terrible disease forever.
If we're really going to make a big impact on diseases like lymphatic filariasis, then we have to take a long-term view, because to try and control and eliminate that is not a 2 or a 5-year program, it's a 20 or 30-year program. Clearly, I hope that we will get to eradication of lymphatic filariasis in my lifetime, and we're getting closer and closer, but I think there's still a long way to go yet.
From Dar es Salaam to Liverpool, mass travel means everyone's at risk of tropical diseases. But fortunately, there's a small army of doctors and scientists determined to beat these bugs, bites, and parasites.
Did you get to see a hippo here?
Yep.
Yeah.
Not so many these days, but there was one here the last time I was here. It might be just around the corner. I've been charged twice.
Really?
Yeah.
In one of these?
Yeah. Not fun. And
How did you just...
You'd be amazed how fast these fishermen can make this move.